Hello, this is Dr. Lakshmi Kiran. Today let's talk about the first ever scan that you're going to do in your pregnancy called viability scan. So the first time one gets to know one is pregnant when one does a urine pregnancy test once the period is missed. Suppose that the way to confirm that the pregnancy is there and it's fine is by ultrasound and what is called a viability scan. So the first ever time you can see a pregnancy sac inside the uterus is at 4 weeks. So what you get to see there is a tiny pregnancy sac, about 2 to 4 millimeters. So the baby and the heartbeat are visible only by 6 weeks. So we usually plan the first scan between 6 to 8 weeks so that we not only confirm that the pregnancy is there in the uterus but also that there is a baby and a heartbeat. Sometimes in certain circumstances where maybe the mother has some pain in the tummy in early pregnancy or bleeding or any other suspicion of the pregnancy not being well, we may have to do the scan earlier between 4 to 6 weeks just to make sure that the sac is inside the uterus. So 6 weeks on, we can not only see the baby, we can listen to the heartbeat. So that usually, and we can make out whether it's a single pregnancy or multiple pregnancy. We can also make out whether the uterus is all fine, whether there are any problems in the uterus or ovaries or any other problems that can affect the well-being of the pregnancy. So this is an important scan which will not only guide us about the baby, about the mother's uterus, ovaries. It will also help us date the pregnancy. We can confirm the age of pregnancy based on this. And the future planning of pregnancy, giving you a due date, for every other thing, this scan is very important. Thank you.